Much indeed. Well, we asked to speak to NHS England, but nobody was available. Paul Healy is Senior Policy Advisor for Economics and Regulation at the NHS Confederation, which speaks on behalf of all organisations that plan, commission or provide NHS services. A very impassioned spokesperson for the Patients Association there, saying it's the poor old patient that's going to suffer, that the situation is crazy.
Yeah, I mean, I think one thing that's important on days like today is that we can't give the impression that we don't recognise the dedicated hard work from finance staff in the NHS. I mean, we've got 20,000 staff who work in finance in the NHS, and in recent census of those people, it showed that only 4% of those people feel that they're valued by the public and 11% valued by the government. And I think that's an important thing to reflect on, because these are the people at the front end in terms of actually trying to make the budgets balance. And
well, sure, but what are they doing wrong? Why aren't they getting the deficits down?
Well, when you've got a deficit of 2.5 billion across the provider sector, which is around 66% of all providers, it's not down to financial management, it's down to a systemic problem in the system, which is the fact that we have a model in terms of how we deliver services which simply isn't being able to cope with the kind of conditions that people have. And we've had a number of political choices that have been made over the last couple of years. One's around underfunding social care, cuts to public health, and also some increased pressures on staffing, whether that's through...
So do you want more money as well?
Well, the decision around funding is a political choice, but the political choices, they have consequences. And what we're seeing in terms of the financial position in the NHS are those consequences. And I think if we have additional funding coming into the service this year, and most of the additional funding that was promised in the spending review is finished by the end of this year, we have to look at how do we actually get on with the transformation that money was provided for. Because I think the concern that we have is that if you try to focus on how you make the budgets balance this year, without thinking about how you set the system up to be better in the future, you kind of have to take the expense that the people that are lost are the patients, because the transformation of services doesn't take place.
Briefly, if you can, what about that idea of fines for trusts who overspend on staffing and other fines? That's going to go now?
Well, I think it's good that the national bodies have thought about the best way to actually incentivise the system. I mean, one of the things which is really important to transformation and the plans that are taking place right now are the relationships that take place locally. And often fines and penalties are not necessarily the best things for helping those relationships, for getting people to work together, to work differently. And if there is a better arrangement, which is about incentivising organisations about the best way to deliver care in their area, then I think that's a good thing to look at.
Paul Healy, thanks very much. Turkey has moved into phase 3.